Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Serum C-reactive protein concentrations in dogs with structural and idiopathic epilepsy. Introduction. Epilepsy is a neurological disease characterized by the tendency to generate epileptic seizures and behavioral problems like aggression or anxiety. To diagnose epilepsy, 2 or more unprovoked epileptic seizures at least 24 hours apart are required. Idiopathic epilepsy, i.e. and structural epilepsy, SE, are the 2 types of epilepsy that differ in their origin. Acute phase proteins APs are activated in the body post-tissue injury, leading to a non-specific inflammatory response. APs like C-reactive protein CRP, serum amyloid A, haptoglobin, alpha-1 acid glycoprotein, ceruloplasmin, and fibrinogen are elevated in systemic inflammation, whereas the levels of negative APs like albumin and transferrin are decreased. In the first 48 hours of a tissue injury, SCRP rises to its highest level, then slowly drops after 8 days. In veterinary medicine, elevated SCRP is a sign of numerous conditions like pyometra, acute pancreatitis, lymphoma, and steroid-responsive meningitis arteritis. Inflammatory reactions occurring in the brain due to epilepsy promote an increased concentration of inflammatory markers in the serum and CSF. Studies conducted on human and canine patients showed that IE and SE cause an increase in the concentration of inflammatory markers. However, there is a lack of research on the behavior of SCRP in epileptic dogs. Therefore, the objective of our study was to compare the levels of SCRP between dogs with SE and IE. We hypothesized that dogs with SE would show higher levels of SCRP than dogs with IE. Material and methods. A retrospective review of clinical records of dogs that presented to the Queen's Veterinary School Hospital in Cambridge from 2014 to 2021 for investigation of epileptic seizure activity was conducted. The study was approved by the Department of Veterinary Medicine Ethics and Welfare Committee, reference CR 456. All dogs included in the study had complete physical and neurological examination done by a board-certified neurologist and were diagnosed with either idiopathic epilepsy, IE, or structural epilepsy, SE, based on a series of investigations. Dogs with IE were diagnosed based on recurrent chronic brain disease with predisposition for epileptic seizures of unknown cause or proven suspected genetic background. Dogs diagnosed with SE had an underlying cerebral pathology that was detected using magnetic resonance imaging, MRI, cerebrospinal fluid CSF analysis, infectious disease screening, or postmortem histopathological confirmation. Dogs were excluded from the study if another medical condition besides epilepsy was suspected. SCRP measurement was not performed within 24 hours of their last epileptic seizure, or if the epileptic seizures were derived from metabolic or toxic disturbances. The dogs were classified as either affected with IE or SE. Data collected included breed, age, sex, date of last epileptic seizure, and any anti-seizure medication that was received within 24 hours of SCRP sampling. Furthermore, hematological and serum biochemical data such as white blood cell WBC count, neutrophil count, monocyte count, SCRP concentrations, serum albumin concentrations, serum globulin concentrations, and bile acid stimulation test results were retrieved. The MRI findings, CSF analysis results, and neurological examination findings were also recorded. A commercially available assay was used to measure SCRP, and the collected data were analyzed using the Statistical Package for the Social Sciences, SPSS, software version 27. Non-parametric tests were used because the data were not normally distributed. The Mann-Whitney test was used to compare the differences in SCRP between dogs with SE and IE, and correlations were assessed using Spearman's correlation coefficient. Data were presented as the median range, and statistical significance was defined as a p-value of less than 0.05. Results. A total of 20 dogs were included in this study. 12 dogs belonged to the IE group, which consisted of 7 male neutered M and 1 male entire, 2 female neutered FN and 2 female entire FE. The remaining 8 dogs comprised the SE group, which included 5 FN, 2 FE, and 1 MN. The age of the dogs at the time of their first epileptic seizure ranged from 1 to 11 years. Dogs in the IE group had a median age of 3.5 years, while dogs in the SE group had a median age of 5.9 years, with 4 of them aged between 6 months and 6 years. The majority of dogs in the IE group were receiving anti-seizure medication within 24 hours before blood sampling. On the other hand, only one SE dog had received PB and DP in the same period. SE group dogs' epileptic seizures were classified according to their causes, which were neoplasia, MUO, and SEUO. While neoplasia group had 3 dogs, 2 of them had primary brain neoplasia, and 1 dog was diagnosed with a primary tumor, including metastatic lesions in the brain. On the other hand, the SEUO group dogs had a brain mass attributed to either inflammatory or neoplastic causes. Among the 8 dogs with SE, 4 dogs had normal neurological examination findings initially. The remaining 4 dogs had at least one neurological deficit recorded. These neurologic deficits were manifested by changes in behavior and impaired motor skills, including obtunded mentation, pacing, getting stuck in corners, tetraparesis, delayed postural reactions, and reduced menace response. The dogs with abnormal neurological exams had neuroanatomical localizations affecting the right forebrain and multifocal intracranial regions. Serum CRP data were obtained for all dogs, with higher SCRP concentrations found in the SE group than in the IE group. Dogs with SE were more likely to have SCRP concentration outside the reference interval, compared to those in the IE group. Dogs in the IE group had different serum biochemical and hematologic results. 1 dog had neutrophilia, and 1 dog had evidence of a left shift. On the other hand, dogs in the SE group had a mild decrease in albumin, evidence of toxic change, leukocytosis, neutrophilia, and monocytosis. In conclusion, this study compared the clinical characteristics and laboratory findings of dogs with 2 different types of epileptic seizures. IE and SE dogs in the SE group had higher SCRP concentrations than those in the IE group, and were more likely to have abnormal SCRP concentration values. The results of this study could aid clinicians in identifying and treating epileptic seizures in dogs, ultimately leading to better patient care. Discussion. The study shows that SCRP concentrations are significantly higher in dogs with SE than those with IE. Previous veterinary literature on SCRP in epileptic patients is scarce, with inconclusive results. However, our study is the first to compare SCRP in dogs with SE and dogs with IE, showing that around 60% of dogs with SE had increased SCRP concentrations above the reference interval, whereas SCRP concentrations remained within the reference interval in dogs with IE. This suggests that SE induces a greater systemic inflammatory response than IE, due to more severe brain lesions and associated blood-brain barrier breakdown. While advanced imaging is often not feasible for many patients in veterinary medicine due to financial constraints, our study found that SCRP could be an additional tool to increase suspicion of SE when referral or general anesthesia is not an option, or prompt further investigations if elevated SCRP is recorded in a dog with a normal clinical examination experiencing epileptic seizures. However, further studies are needed to support the use of SCRP as a screening tool for SE in dogs. Regarding canine IE, it is unknown if it has an inflammatory background, but it is possible that some canine IEs may be associated with inflammation and raised SCRP, accounting for variation in SCRP observed in dogs with IE. Further studies on the effects of anti-seizure medication on SCRP in dogs are also warranted. In conclusion, this pilot study suggests that SCRP could be useful as an additional tool to prompt further investigations into SE, or increase suspicion of SE, when advanced imaging is not an option. However, further larger studies are needed to confirm these findings and to exclude other systemic inflammatory disorders.